Burkina Faso is currently in the grip of a triple crisis: armed conflict, COVID-19, as well as floods. Increasing violence in Burkina Faso, in Mali and neighboring Niger have led to a 62% spike in deaths and more than 1 million people being forced to flee their homes over the last year. Heavy rains have affected over 7,000 people, according to authorities. I spoke a little earlier today to the head of the International Committee of the Red Cross delegation in Burkina Faso, Laurent Saugy, about the situation in the West African country. Mr. Saugy, thanks very much indeed for joining us. The situation in Burkina Faso seems to be escalating, and some have described it as catastrophic.
Yeah, you are right. And if you ask the question to the civilian population here in Burkina Faso, for sure, they will describe it as catastrophic. It's endlessly challenging. You know, today in Burkina Faso, 1 person on 20 is a displaced person. 5% of the total population is in displacement. Looking also at the situation of the climate shocks, it's for sure a desperate situation. And obviously, the escalating level of violence is putting the civilian population, all types, and for sure, all parts of the country is currently affected.
All right. So, what in particular has exacerbated this? What is it? The conflict? You mentioned other issues, but let's start with the conflict.
Yeah, you're right to mention the Sahel. Burkina is part of the central Sahel, is one of the affected countries. So organized armed groups across borders challenging the state authorities have embarked in heightened hostilities. And very often civilians are paying the high price. They find themselves between a rock and a hard place. And many of them have chosen or seen the only solution is to flee, and generally towards urban centers where they sense that they feel a bit more secure. Which in the case of Burkina, as I mentioned earlier, results in 1 million, today 1 million persons displaced.
This then must be putting a strain on healthcare and the ability to provide healthcare with so many people not in their homes.
Yes, you're absolutely right. And let's remember that Burkina Faso is, by definition, already challenged in terms of means and infrastructures. So the health system was already in a poor state in some remote places in particular. So therefore, having such a number of new patients, namely the displaced persons, reaching these places, represent an incredible pressure on an already very weak, if not tired, when existing system. It's not only the question of health. Health is for sure illustrative, but take the water, the access to water. When you have in a city like I don't know, like Kaya, that is simply doubling its population in a few months. What does it mean for host population, but also displaced persons, to have sufficient access to quality water? Very much linked to health, of course. The provision of medicaments to have health centers empty is not, of course, not a solution. So therefore, the provision of medicaments and the strengthening of the pediatric response is of vital importance. And let's remember that since March, Burkina Faso, like all countries in the world, is affected by COVID-19. COVID-19, yet another tremendous challenge for a health system. It was extremely important to support the health authorities in this country in their response to the COVID-19, without forgetting the humanitarian aspect of the situation in Burkina. And you know, it's 26 years now that I'm doing this work, and rarely I saw a situation where so many multi-layered difficulties are affecting the population and affecting the authorities. It's a true challenge for them to face this multiplication or this variety of challenges. I mentioned earlier the climate shocks. I'm not an expert. I cannot say if the recent floodings were completely connected with what we call the climate changes. But yet again, it represents destroyed houses. It represents health centers just washed away in the midst of such a already challenging situation.
So with this triple threat, armed conflict, COVID-19, and these floods, what is the greatest need for the civilian population on the ground at this time?
If you ask them, which we do, of course, because we don't think for them, we think with them. If you ask them, they will for sure mention safety first. Safety first, safety for their families, safety for their children, availability to go to school, the large proportion of persons displaced are children. So yet again, everything is linked. COVID closed a number of schools. Some schools were closed and burned down because of the conflict. So safety, access to school for the children, and job. Probably or certainly many of them will turn to their authorities or to us and to say, listen, we want to have the ability also not to be depending exclusively on humanitarian assistance, but we want to survive for ourselves and with our own means. So these would be the three elements that I would mention. But if you allow me, I would link it also, the first one, the safety, to access. The overall access for the civilian population to basic services, but also to humanitarian assistance, and vice versa, namely ensuring access for humanitarian organization to ensure some proximity to the affected population, and as I said, to ask them to include them in the design of our response for the needs that they will first express.
The need seems great, and I just wonder, what can the international community do to help? And it seems like a lot of help is required quite quickly.
Yeah, you're right. It's again multifaceted. the international community is composed of different parts. So I will speak in particular of the humanitarian community that is trying to help and support. There is the international humanitarian community that has to work with local partners, civil society, in our case, very close cooperation with the Burkinabe Red Cross, extremely important with its hundreds of volunteers spread in the country. So to have a well-coordinated humanitarian response among all organizations that are trying to set their programs here. Then you have the community of course, of the donors and the supporting countries, and acknowledging that the needs are massive is already a first step. But then to mobilize themselves to support Burkina is absolutely key. There is, I hope you hear from my tone, that there is a sense of urgency, of emergency, and although, of course, everything needs to be coordinated and well thought of, it should not delay the support and the response to and for the Burkinabe people